Talented Grandma has a great question. For people who sometimes when they take their medication, which they need to take, it causes constipation. What are some suggestions that can help with that for people who have kidney disease?
Yes, and actually, constipation is the top concern for people with chronic kidney disease for several issues. For one, like was mentioned, the medications. They're people with kidney disease are on a handful of medications, and those medications come with side effects. The other concern possibly is, as we also talked about, fiber. If you're not getting enough fiber, because let's say you're scared of potassium, because potassium is found in a lot of fruits and vegetables and plants, which also come with fiber. So if you're scared of potassium and you're trying to cut that out, you're probably going to really struggle getting enough fiber. So getting more fiber, even in low potassium forms, like raspberries are lower in potassium, but they're packed with fiber. So you can have berries that are typically lower in potassium. But again, just like phosphorus, if your potassium isn't an issue, including high potassium fiber rich foods are also really good too, because if you have high potassium levels, it could be caused by the constipation that's not letting your body get rid of the potassium. So there's all these different kind of complicated cycles that are working together. So addressing the constipation can help keep potassium levels in check. So we've got the fiber, we've got the other one is hydration, making sure that you're drinking plenty of fluids throughout the day. Make sure you're spreading it throughout the day, because even if you're getting in a lot of fiber, if you're not getting enough hydration with it, the fiber is not going to be able to get places that it needs to get. It is not be able to get through your digestive system and move things through your body. So make sure that you are well hydrated. Another one is exercise, physical activity. So physical activity is really, really helpful to stimulate gut activity, especially after you eat. So if there's one type of lifestyle change I would recommend is starting to build a practice of moving after you eat. I know it's really, really easy for us to eat a meal and then just like melt onto the couch. But if we can, it doesn't even have to be dinner, like maybe breakfast or maybe lunch would be a better time to kind of start a habit like this. But after you have a meal, take a gentle 5, maybe 10-minute walk. And it doesn't even have to be outside. It can be inside, just kind of moving around your space, whatever works for you. But that movement really helps stimulate blood flow, gets everything moving through the gut. So that can also be helpful, really, especially after a meal. So we talk about fiber, hydration, movement, and the other thing too is stress. And it doesn't help anyone to be like, oh, just stop stressing, but look for ways to help manage your stress better, whatever that looks like for you. It could go back to the physical activity, finding something that kind of helps you, like yoga or stretching. It could be meditation. It could be therapy. Finding a therapist who can really help you with chronic disease management can be really, really powerful. But finding ways to help with stress, because stress does have a significant impact on the body and can manifest with constipation. So those I would say are some kind of the bigger ones to be really focusing on when it comes to constipation. And then finally, if you know that it is a medication that is causing a side effect, definitely let your doctor know, because they might be able to prescribe something different that doesn't have the same kind of side effect. So you can definitely talk with them or talk with your pharmacist about it as well. Don't make any changes to your medications before talking with your prescribing provider, though. That's really, really important. But, if you say, hey, I've been taking this medication and it's been like 5 weeks now, and I am just everything is slowing down and nothing's happening for me. Like, it is important that they know that, because again, that can reflect into other labs, and it's going to impact your life overall. You're not going to be hungry. You're not going to be interested in doing a lot when you're feeling like that. So it's important to get it addressed from that point as well.